Hello everyone. I'm sitting here with Renia Vagkopoulou from Médecins Sans Frontières, from MSF, and we had this discussion earlier yesterday about the situation in Greece in terms of HIV, refugees, and health in general. And you told me some outrageous and very scary things. And I thought that it would perhaps be interesting for our viewers in the EATG community and the wider HIV community to learn more about the situation, which really seems scary. So, Renia, can you tell us more about what's going on in Greece right now?
Thank you very much for your questions and your interest. I will start just by doing a description of the situation nowadays in the country in terms of the public health system. So the economic crisis is still there. We have been having a change of governments in the last years, but the economic crisis is still there. The structural adjustment programs are still in place, and the public expenditure on health as a percentage of GDP is extremely low. Nobody really knows what that is, but from recent discussions with the Minister of Health, it's about 5% of the GDP. It used to be 4.9%. Before the crisis, it was around between 7 and 8%, which is the European average, normal average. But during the crisis, it fell down to 4.7%, and nowadays we are in 5% of the already extremely minimized GDP due to the austerity cuts. So in this framework, Greece also had to face the increase of refugee flows through the country, which, as you might all know, at some point the northern borders closed, and the EU-Turkey deal was signed between the European countries and Turkey. What this created in the country was actually a division of the country. So we have the Eastern Aegean Islands that they nowadays, after the deal, they are the entry points, but also the blockades of the refugees, which restrict them to continue their journey even within Greece, not to say in further northern countries. So all the people that arrive in Greece through the islands are stuck there, and they are obliged to stuck there under the deal, which means that they live under extremely bad conditions in the so-called hotspots, which are detention camps, for many, many months until their applications are processed. MSF has activities in two of the islands, Lesbos and Samos, which host thousands of refugees each one, and their numbers continue increasing because people are still coming. Although the numbers are low, you can imagine that even 200 more people in an already extremely overwhelmed facility means a lot. So there are two options for the people that they live on the islands under the EU-Turkey deal. Either they claim asylum in Greece, and then this process takes a lot of months till the bureaucratic procedures are in place, or if they are denied to be accepted as recognized refugees in Greece, they will be sent back to Turkey under deportations. MSF clinics have been having also patients that they are HIV positive. What does that mean for these people? They, as I said before, according to the legal to their legal status, which was constructed under the EU-Turkey deal, they are not able to continue their journey in the mainland, where hospitals exist that can provide the specialized care that these people need. We have been having a lot of times a situation where we have HIV positive people. The hospitals on the islands and the facilities on the islands, due to the economic crisis and due to the existing situation, cannot correspond to the needs, which would be first screening of their health condition, and then a provision of the specialized treatment. So there are no reagents in this hospital that they can do the CD4 count and the viral load count on the islands. The legal status does not allow them to continue their journey on the mainland where such facilities exist. That means they are stuck on the islands in the hotspots being HIV positive without treatment.
So, once again, do I understand you well? This means that these people are sentenced to death, practically?
Yes, this is right. A lot of actors, together with MSF, we have first of all identified the situation, and these HIV positive persons is one group. You can imagine that there are a lot of groups that they need specialized care that these small islands cannot provide. So we have identified the situation of vulnerable groups being stuck there, and we have been pushing in many levels in order for these vulnerable groups to leave the island and continue onto the mainland, where they can have access to proper care. We have managed for some patients of ours, after a lot of advocacy and a lot of pressure on many levels, especially Ministry of Health, Asylum Service, First Reception Services, and Ministry of Migration, to take these people out of the islands, and I'm talking now about the HIV positive persons, that they have managed to come to our clinic, and bring them to the mainland where they can have access to specialized care. However, this took many weeks, some took months. In other cases, we just lost the people because when it's such a procedure that it takes such a long time, the patients cannot be found so easily, or we might ask them, please come back, and they might not come back. So this restriction, geographical restriction, which actually changes the island into a prison, where there is no proper provision of care, do sentence vulnerable groups to death.
I don't think amazing is the right word. It's awful. It's a terrible situation. Now, I understand from what you told me now and also yesterday that this also entails the risk of another outbreak, like what we saw years ago under your previous government. And also, if I consider the shape that your healthcare system is in Greece, that's also an inherent risk. Am I right, or do you see this differently?
No, I think you are totally right. Vulnerable groups are in threat. I don't want to be, because there are a lot of voices, also xenophobic voices, that talk about a hygiene bomb that is ready to explode in Greece or in the islands. I have to say that with the advocacy pressure, especially towards the CDC Center of Greece, it has been mobilized. So now the issue it has been acknowledged, and hopefully all the necessary measurements are taken so that we don't see an outbreak. Therefore, I would like to be realistic and observe the situation, and in the meantime push for uplifting of the geographical restriction of all the vulnerable groups, so that an outbreak will be prohibited. We don't have the data. This is another issue, that we don't really have the data in order to say if an outbreak will happen or not. I wouldn't say that we are just before an outbreak in the hotspots. This would be an extreme
exaggeration.
An exaggeration. But definitely it is a situation that needs to be monitored and needs to be handled in order to avoid such a situation. The situation on the mainland, however, is different, because we have been facing, as I told you before, a lack of budget in public health programs. They were the first ones, always there, the first ones, preventive public health programs to be cut when such cuts are put in place. And nowadays, from testimonies of people who are doing field work, We know that in the center of Athens there is a lack of programs that disseminate syringes between intravenous drug users. So this issue has been faced before in Greece in 2012, which we know that it led to an outbreak within this group. And we have to be extremely careful so that we don't face the same again. The interesting in this nowadays is that, as CDC claims, money is there. But the bureaucratic procedures are so long that they cannot really allocate the money so quickly onto the programs that need these syringes right now. So there I would think that we have to be more alerted, and we have to learn from the very recent examples that we have, and immediately activate again. These programs are activated, but they say that we are lacking syringes very soon, so to make sure that there will be no stop in the provision of syringes.
So this means that it's harm reduction hindered on every front. So it's harm reduction in terms of the refugees flowing into the country, harm reduction for your local population or your own population. And this really sounds awful. Where do you see a solution? Because obviously, however big MSF is, you are engaged in many fronts, in many countries. It's not something that you can solve on your own. Can you work with the government, or where do you see a solution, or how do you think that we can mobilize the civil society to help you more or help the situation more?
It's the situation right now, as I described it before, especially when it comes to the refugee population living in Greece, is something that is above the Ministry of Health and above the national level. It is an EU-Turkey deal, which means that actions have to be taken in an EU and international level. So we have faced actually a very good will from the Ministry of Health, which understands the issues and definitely does not want to be faced with any outbreaks and with any further health issues. Also, because the local population of the islands shows its dissatisfaction with the situation. The Ministry of Migration, however, is the one I think that where we should focus our pressure, because it does have a say on to which vulnerable groups can just right now leave the islands. It does have a say on which procedure have to be put in place in order to identify vulnerable groups on time and not let them be stuck there. It does have a say on what kind of conditions these people live. The hotspots probably you've seen around are in an extremely bad conditions where healthy people, if they would be put in there, it's a matter of time of getting sick. So I think the pressure should be put on the Ministry of Migration, using arguments of the Ministry of Health and of the Health Society. The different NGOs and the civil society understands the problems, and I think that we have very strong alliances, also with the local population, because they really want also the refugees to forward their journey. So I think it's a matter of condemning clearly the EU-Turkey deal, and trying on an international level and national level to show that this is no sustainable solution. We know that in some islands already detention centers have been built up inside the existing hotspots. So instead of actually going one step further and releasing these people, they are imprisoning them more and more. We don't know who will be the health actors that will have that will observe the population in these detention centers till now, and that needs to be monitored very quickly, because we need an observatory body who knows what is going on in these detention centers. So I would say definitely it's migration policy and together with health policy but mostly focus on the Ministry of Migration.
Well, thank you very much. I think that what we can do on our part is that we will try to mobilize people within the EATG and the HIV and hepatitis communities to support your work as much as we can with advocacy efforts. But it's a really, really alarming situation. Anyway, Renia, thank you very much for your time.
Thank you.
Thank you.